The goal of the nurse presentation is to succinctly present key information about the patient in a consistent and standard format, and to raise concerns that you and the patient need addressed. The recommended approach is to print and annotate your acute care handoff form at the time of morning handoff. The content should include events, vitals, pain, I&O, activity, wounds, VTE prophylaxis, safety, devices, and concerns. Some items are automatically populated on the handoff form, but you may need to make notes from other areas of the chart to describe, for example, overnight events, pain control, or VTE prophylaxis. Another important goal of your presentation is to stimulate in-person communication. As you get ready, think of all the items that might generate a page later in the day: electrolyte replacements, diet and activity changes, and so on. Make a note of what you need for the patient to advance their care so that you can discuss it at the bedside. All the information presented by the nurse should be presented in about 90 seconds. Sticking to the format really helps everyone know what to expect and streamlines communication. Let's watch Sam present Miss Quincy.
So, Sam, could you present the nursing report?
Absolutely. So overnight, Miss Quincy's blood sugar got up a little bit to 350, and she required an extra dose of insulin, but she had no changes on telemetry. Her vital signs this morning were heart rate of 80, blood pressure was 140 over 95, temperature was 37.9. Respiratory rate is 14, and her oxygen level was 95% on room air. She has some pain this morning in her abdomen, 3 out of 10. She required 4 doses of oxycodone overnight. Her ins and outs have been 2,500 milliliters in and 2,300 milliliters out. Her weight on the bed scale this morning was 60 kilograms, and she had 5 bowel movements on lactulose. She's been taking all her lactulose. She's been oriented times 3, a little bit sleepy at times, but she's been getting up with one person assist to the commode, and we did note a stage 2 pressure ulcer on her sacrum, and we have a Mepilex on that right now. She is prescribed heparin, but because of her ascites and tenderness in her abdomen, she's been refusing that. So I'm hoping that if you guys are able to talk with her about that today, I think that would be great. She's definitely a fall risk. We've had the bed alarm on. She's only set it off a couple times overnight and has been easily redirected. She has the telemetry on. She has a PICC line on her right arm and a peripheral IV on her left. She has a Foley catheter in still. So my biggest concerns for today are adjusting her insulin to get better control of her blood sugars. We would like to get an air mattress for her pressure ulcer per the wound nurse's recommendations. I would also like to hopefully discontinue her telemetry and pull out her Foley catheter if we're able to.
This was a model presentation. It took 90 seconds and addressed the most critical issues. Let's run through it again and see what made it so good.
So, Sam, could you present the nursing report?
Absolutely. So overnight, Miss Quincy's blood sugar got up a little bit to 350, and she required an extra dose of insulin, but she had no changes on telemetry.
Presenting information in the same order is helpful for other team members. In general, you should start with overnight events, addressing topics such as unexpected events or symptoms, significant test abnormalities, changes in status, or new complaints. This material will need to be gathered from the previous nurse or their charting. If you are not asked to present after introductions, politely interrupt and ask when would be a good time to present the nursing information, as your information is valuable to the team.
Her vital signs this morning were heart rate of 80, blood pressure was 140 over 95, temperature was 37.9, respiratory rate is 14, and her oxygen level was 95% on room air.
Here, the goal is to avoid statements like vitals are stable, and instead provide exact and recent values.
She has some pain this morning in her abdomen, 3 out of 10. She required 4 doses of oxycodone overnight.
This information may require a brief review of the MAR or the PCA field of iView to present. Since agreement with the patient on a pain management plan is so essential to patient satisfaction, take this opportunity to build a shared mental model of how much medication the patient is requesting.
Her ins and outs have been 2,500 milliliters in and 2,300 milliliters out. Her weight on the bed scale this morning was 60 kilograms, and she had 5 bowel movements on lactulose. She's been taking all her lactulose.
Most of this information should be populated directly into your handoff form. However, it is important to make sure of the date on which the data was collected to make sure that the weight is truly recent. If today's weight isn't available, please instead say, "The patient hasn't been weighed yet today," and I'll call the PCT to make sure that it's done.
She's been oriented times 3, a little bit sleepy at times, but she's been getting up with one person assist to the commode. And
this may also be an appropriate time to mention any concerns with PT or OT, but otherwise this section should be brief.
We did note a stage 2 pressure ulcer on her sacrum, and we have a Mepilex on that right now.
You may skip this section if the patient doesn't have wounds and is not at risk of developing them. If there are wounds, this would be a good time to coordinate their exam to avoid unnecessary dressing changes. For example, you could say, "I'd like to undress the wounds at 1 p.m. with some pain control. Could you enter an order for a one-time dose? If you would like to see it, that would be a great time to stop by."
She is prescribed heparin, but because of her ascites and tenderness in her abdomen, she's been refusing that. So I'm hoping that if you guys are able to talk with her about that today, I think that would be great.
This is a great opportunity to catch patients who have no VTE prophylaxis in place and to come up with solutions for patients who decline the therapy that's been ordered.
She's definitely a fall risk. We've had the bed alarm on. She's only set it off a couple times overnight and has been easily redirected. She has the telemetry on. She has a PICC line on her right arm and a peripheral IV on her left. She has a Foley catheter in still. So my biggest concerns for today are adjusting her insulin to get better control of her blood sugars. We would like to get an air mattress for her pressure ulcer per the wound nurse's recommendations.
Saving these concerns until the end is helpful for everyone's workflow. If you present questions before going through the data, it might make it hard for the rest of the team to answer the questions. Also, closing with your questions means there's a natural transition from the nurse back to the medical team.
Hopefully discontinue her telemetry and pull out her Foley catheter if we're able to.
Do not miss this opportunity to remove unnecessary devices. Research shows that many providers can't recall which of their patients have devices that predispose to falls and infections. By prompting that discussion, you can have a major impact on your hospital's fall rate and avoid wasteful use of telemetry. During your presentation, you may be asked to update the patient's whiteboard with the plan of the day and plans for discharge. The attending is responsible for making sure the whiteboard is updated, but may delegate the task to any member of the team. When the providers are finished discussing the plans, and before you leave, review the whiteboard with the patient and the team to ensure that the information is correct. After the whiteboard has been reviewed, if the team does not excuse you, politely interrupt and let them know that you need to leave.